Now, the MIM Health Center in the Sonafo North municipality of the Bono Ahafo region is in dire need of rehabilitation. The structures of the facility are now in high state.
Established by the community in the early 60s. Since then, it is yet to see any renovations. MIM has a population of about 27,000, most of whom receive medical attention at this clinic. There are 30 professional and non-professional staff at the clinic. The OPD sees up to 70 patients daily. 80% of patients are registered under the National Health Insurance Scheme. Records show that close to 60 deliveries are carried out at the clinic monthly. However, there are only 3 beds available to admit them for unspecified periods before discharge.
This is the labor ward, this is the line in back. When you finish delivery, this is where you lie.
Sanitation at the health center is also a problem, as water has not been running for months. Madame Peace Aivo is a senior midwife in charge of the MIM Urban Health Center.
If you look at the statistics, I think MIM needs a polyclinic. We are the only government health provider in MIM. Our building is really old. You can see fallen ceilings, cracked walls, no toilet facilities, no water, no bathroom for staffs, no place of convenience, no changing room, no staff common room. The infrastructure actually is old and we need a new one.
All right, let's come back in studio, and we have a special interview coming up shortly, but just give you a brief background. A development expert and renowned economist, Professor Jeffrey Sachs, is in Ghana, and one of the key things on his itinerary is to help Ghana review her healthcare system. The professor will also help position Ghana to become one of the first few countries in the world to implement a comprehensive state-of-the-art ICT platform for health and create unique ID numbers for all patients as a sustainable means for achieving the Sustainable Development Goal 3, which seeks to ensure healthy lives and promote well-being for all. And we have him in studio to pick his thoughts on a number of things. Clearly, I'm sure the issue that the world is talking about is Brexit. We'll pick his thought briefly on that. Then we can zero into the SDGs, which is also of prime concern to him and to us as a country. Good afternoon, sir. Thank you very much for joining us.
How are you?
Very well, thank you.
Good.
Yeah, to start with, I mean, you work not only in the United States or with countries like Ghana, but clearly you have some strong partnership with the United Kingdom as well. The UK has decided to leave the European Union. Are you surprised by that decision?
I think everyone was surprised by the outcome because all the predictions were basically going the other way. But all of the societies in Europe and in the United States are pretty much divided 50-50 now on how globalization is working. So it's a pretty tense situation. This is going to take up a lot of time right now because the UK is in crisis. Will there be a United Kingdom? Will Northern Ireland unite with the rest of Ireland? Will Scotland stay in? These are pretty basic questions for the UK now. Yeah,
but globally, what kind of impact do you think, or I mean, from where you sit and what you do you think this decision by the UK is going to deal any blow to development globally, especially for countries like Africa, for continents like Africa and then countries like Ghana?
Well, I think it's a distraction in a sense because it will divert attention from long-term issues, whether it's development or climate change or other issues, into this nitty-gritty internal issues. And I think it will therefore be adverse. But I hope and think it can be kept just limited effect, small effect.
Okay.
That's what everybody has to work on. I want everyone to be calm in the UK and in Europe, negotiate on good faith, and solve the problem quickly.
All right, so and clearly you are in Ghana for some very pertinent issues, and let's zero in on that now. SDGs, and over the years it moved from MDGs because they thought that they needed to widen it and then get some specifics down. Now Sustainable Development Goals. Interestingly, the persons who are the target when the decisions are being taken are the very poor, how we can have a level playing field and give them good health care, meaningful lifestyle and all of that. In the course of your work, can you say that the impact has begun and is being felt by the persons that target for the SDGs?
There's definitely improvement during the past 15 years when we had the Millennium Development Goals. And these new Sustainable Development Goals are another 15 years. They start in 2016, they end in 2030. I'm very happy that President Mahama is the co-chair of the Global Sustainable Development Goal advocates appointed by UN Secretary General Ban Ki-moon. So here you have your president is one of the two leaders of advocating for the Sustainable Development Goals in partnership with the Prime Minister of Norway.
Yes.
That's a good
Yes.
sign.
Yes.
That is because the world believes that Ghana has a great chance to really make big breakthroughs right now, even though the economy is shaky and inflation's too high and there are many problems. There's also real chance for big breakthroughs.
Because some of the complaints we've heard have had to do with the fact that it seems people sit in boardrooms and big offices and take the decisions, but then doesn't trickle down to those who are actually, to be affected by those decisions. Do you get such complaints too?
Well, that's a real worry because it's easy to make a big declaration, but to see results on the ground is something quite different. One of the reasons I'm here this week is that when we have the smartphones or you have your tablet or we're able to go on mass media or social media, we have the new information and communications technologies. It's very low cost. It can reach just about everybody. How many phones, mobile phones are there in the country now? And e-payments, new systems. So this week we're studying how to use these very effective new tech methods for better healthcare delivery, better education delivery, better governance, even the voting system, big issue here. How do you get the names right on the rolls? Unique identification. So this is a big issue for me this week in my discussions with the government.
Good, and then that actually links to my next question because we're going to be going full ICT based, though gradually. Would you say we can achieve it, and what's the timeline we're looking at? Because ICT penetration in Ghana generally has increased but hasn't gotten there yet.
It needs to go very fast because if you can make the ICT platform, then schools can be better, clinics, telemedicine, emergency calls, things like that. Everything can go better, including also the voting rolls, which I mentioned. So we just heard in our conference today from the head of the unique identification agency, which is trying to provide a government ID to everybody. Well, the work's underway, but it needs to be speeded up. And I'm also involved with India, which has registered 1 billion people, if you can imagine, almost as many people as in Africa, with an iris scan, an eye scan, which gives a unique identification online, and then it gives people access to online payments, online banking, online government services. So this is something that could come
a lot
quickly.
needs to be done apart from getting the information down. The government and state institutions that need to get the platform ready need to do a lot more.
Exactly, and I'm trying to get the Indian government to be more engaged also because they have some really great experience that they could bring to Ghana and bring to other countries of Africa.
Okay, my final question would then be, how is this going to be funded? What kind of assistance are we going to be getting from maybe UAFE and then Ghana as well? What is our contribution and how is this whole project going to be funded?
Well, Ghana, of course, has to use its budget properly, and now there's going to be more oil revenues coming in. Important to invest those in development, not to waste them, but to really invest them in development. Important to collect the taxes that the international companies are supposed to be paying to make sure that that can be paid. And then I work in the UN as a special advisor to the Secretary General of the United Nations to help mobilize other funding. During the past 15 years, we had big gains in Ghana in improved health, reduced mortality, partly through the Global Fund to fight AIDS, TB, and malaria, Gavi, other international programs. I'm always out there trying to get the funding to match Ghana's own funds, the tax payments by the multinational companies, and international assistance. Put the package together.
I see. Now, what is the timeline we're looking at here? How soon can we see some activity in this regard, where people can now through their mobile devices, say I have registered on this platform and I can get some health attention if I need that?
Well, that's the purpose of our meeting this week, how to speed this up. But
Okay.
India registered hundreds of millions of people in 3 years.
Okay.
So Ghana's very small size compared to India. So
Just about
Ghana
25
really
million.
should be able to do this quickly within a couple of years. And I hope that if India brings some help and if the government makes the big commitment, that this could really move forward dramatically. That's my hope, because once it's there, many other good things will happen.
Okay. All right. I think we'd have to leave it here. But your itinerary for today includes what else from today? What would the other major engagements for you be?
Well, I have a very wonderful, busy week because I have a conference, I have a public lecture at Legon at the University of Ghana campus. I'm meeting with the economics team later this week and going to Kumasi to meet with the cocoa cooperatives there and others, and I hope the Otumfor, if time permits for him, because that's always a great honor, and he's a wonderful person. I always enjoy seeing him. Okay. So it's a very busy schedule, but I'll be here for the week.
Okay. All right. Thank you very much. It's been great talking to you.
Thank you.
We've been speaking with Jeffrey D. Sachs. He's a renowned economist and then also the director of Earth Institute, Columbia University. And he's here on a major project to ensure that at least we are able to register on an ICT platform for better health accessibility and several others.